Hi, welcome back. Today we are an important aspect, that is ethical consideration in consent. Yes, it is a very important aspect in examination point of view where consent can be wrong if it is not taken correctly. Yes, the nurse is playing a very important role. Here I am going to tell you the important role of a nurse. What is the important aspect as a nurse when taking a consent from the patient? The nurse is not responsible for any type of explanation of the procedure, but it is the responsible by the concerned physician or the surgeon to explain the procedure to the patient before taking the consent. Yes, but one important thing what nurse should always see is verifying whether the consent is present for any type of procedure. In many settings, it is most essential to take the consent for each and every aspect before starting a procedure. Invasive procedures, yes, it's like intubation or it is any small procedures of insertion or small operation, major surgeries plays a very important role. And patient, we have to assess the patient's capacity. Yes, whether he is alert and oriented to sign the particular consent, and ensuring the patient should consent for the procedure voluntarily by himself. It should not be out of force. Yes, if it is out of force, then this consent goes invalid. And notifying the provider if the consent is invalid. So you have to notify the provider who is, it might be an physician or anyone. We should notify them whether if it is invalid. Here I'm going to tell the exam trap, what it is necessary in, what is the situation and who is responsible for particular action. The provider didn't explain any risk regarding the procedures, then the responsible person who will be held is the provider himself. And next one is the consent signed. When the patient is sedated, then it comes under the who will be responsible here is the provider, the care provider, that is a physician, and the nurse. If it is not stopped, the nurse has all the rights. If the patient is sedated, should not take any consent from that particular type of patients. And nurse should explain the procedure. No, this is not under the scope of nurse because she is not. She cannot explain any sort of procedure, but she can witness it. Yes, nurse witnesses, but patient is confused in some situation. Here, the nurse